As the manager and a registered nurse or a patient advocate, I have seen the huge benefits of palliative pathway activation towards our residents, the families and the nurses. It is important to change the mindset and the culture of the nurses in seeing POI as one of those huge paperworks. Instead, it is a very significant and useful tool to improve the services we offer, to work as a team and strengthens our purpose, which is to bring the best of life for our residents. There are so many benefits of the POI, and for the several months that I've been using that, there are tremendous benefits of it for the residents, the family, as well as for the staff. What do they really want? They're planning their end-of-life care. And for the family, it gives them the time to grieve. It gives them the opportunity to, okay, we are following what my mom, what our dad wants. That is the benefit as well for the family. And they don't feel obliged that it is their responsibility. And as well as for the staff, it is also a good a pat on the back for the staff, that knowing that what they're doing is for their residents, not what they want, not what the family wants, but what the residents want. As the manager and as a registered nurse, and also as an advocate, the important thing to do there is to change the culture or the mindset of the nurse staff, the nursing staff, because on top of the, to making sure that this is not another one of those huge paperworks, but to sit back and say, actually, this is beneficial, this is significant. And so having that continuous, sometimes 2 steps forward, 1 step back, but again, it's just encouraging, and the team are very, very helpful. If you think that you don't understand, you go back to the POI team and they'll get back to you. And it's that teamwork, basically. There are so many outcomes that we have seen in activating the POI, or the palliative pathway activation, that it's hard to explain. There's so many when it comes to the family, the patient, and the residents and the staff. Let me give you one example. I had a patient, he said, do you know what? I was born a Catholic, and I'm not a practicing, but I'd really like to have a priest. In that, following the same time, same day, we contacted the parish priest of the community, and the parish priest came in. And for that, having that, able to communicate and say what they want, because in POI, it is not just about the physical, the mental, but also the psychological. It is a holistic assessment that you can provide for the patient. We're using the POI payment for a lot of things. And this is the positive thing that I am telling the staff members, the nurses we're in. It's a win-win situation. You do the POI, the palliative pathway activation, for our residents. This payment is used for education, for upskilling our nurses. Put it back again to them. For example, this month, we had the POI team who did education for communication in death and dying. The staff, when it's their day off, they still come and they get paid for that. So that's how we utilize them. Sometimes as well, if a staff member, if a registered nurse needs syringe driver pump competency training, then we use that as well. We introduced the POI team. First thing is, I had the POI team that came and introduced that to us, and then we started them, and we also sent 2 nurses as linked nurse training, and then from that they came in, and I support them as their manager as well. If there were so many questions and queries, I can always contact the POI team. If we needed further training, they come and do training for us. And working as a team together with the external health providers, such as the POI team, we do a great job. And this is the secret, or how it became successful. It is actually really good having the feedback from the POI team, because they look at the medications. Sometimes as well, they look at the counseling. We've got so many support that they can offer. I had a resident Also, for example, is I had a resident who is kind of depressed. Now, the POI team has suggested, why can't we have a counselor that comes and talk to your resident? And we have gained consent as well for a resident for this. And she had that conversation, and it's a continuous meeting.